Hi there, welcome back to Quinn Clinics in Bristol and specifically to our laser room. Dr. John Quinn here, and today I'm going to be showing you an IPL treatment for a medical condition known as rosacea. It's thought that it's likely a genetic condition. It probably comes from the Vikings, and it's also related to a particular organism that we have living on our skin, nice I know, called the Demodex mite. And there are different kinds of rosacea, so some people present mainly with spots or papules, some people present mainly with flushing and persistent redness and thread veins related to the same. Some people get dry eyes, which is known as ocular rosacea, and then rarely the whiskey nose, the classic old Irish priest, and that's very uncommon and tends to only happen in men. So we see a lot of rosacea here at the clinic, and during the winter we're doing multiple treatments every single day. It's important that when you're coming in initially for your consultation, wherever you go, that you're properly assessed and managed. So often I'll prescribe either topical or oral medication depending on the indication that I'm going to treat. Laser or IPL, specifically the luminous M22 IPL, is my go-to device when I'm treating flushing and redness and thread veins related to rosacea. So today we have our gorgeous patient Alison, who we've known for a couple of years, more years than I want to say. And Alison's had treatment on a number of occasions in the past, but hasn't for 2 or 3 years, 2 years?
Couple of years, yeah.
Couple of years, fine. So we're going to show some before and after pictures of of her progress a couple of years ago when she'd had a couple of sessions. But today is going to be a top-up session. And like I said, for this I'm going to use my luminous M22. What I love about this device is it's flexible. I can use different cutoff filters depending on what I want to achieve. And my protocol for IPL is always to do a number of passes using different cutoff filters. When I'm treating flushing and rosacea, I'll generally use a triple pulse. So why is this? When we're talking about lasers, lights and IPL, the concept of thermal relaxation time becomes important. So the TRT is the time that takes essentially for the target tissue to cool down by 50%. And if we're treating a vessel in the skin, this is going to have a longer thermal relaxation time than the surface of the skin. So if I want to treat a deep vessel and I deliver the energy in 3 pulses, it allows the vessel to continue to heat but stops me from burning the skin. So this is important because it means using the luminous M22, and to my knowledge it's the only device that we can do this with, I can deliver really high energy, but because I deliver it in separate pulses with an individual pulse delay between each of those pulses, it means I don't injure the skin on the surface. The other thing that most people find when they have a course of IPL for the rosacea is that because it heats the skin, there's also almost like a non-ablative laser effect. So we improve the quality of the skin. So I tell my patients that often the skin's going to be more luminous after they have their luminous. Get it?